When it comes to groceries, when prices rise, you can find ways to save, from generics to coupons. But what do you do when your employer raises your cost of health coverage? There's no coupon for that. And according to one recent report, the cost of the American worker has risen 30% in just the last 3 years, when you combine raises in premiums and more out-of-pocket cost. So what can you do? You use some of the same tools you'd use to save on food. For example, you can track and manage your healthcare expenses with free sites and apps, kind of like a Mint.com, but for healthcare. You can also see if you're being charged a fair price, with sites that will tell you what average prices are for all kinds of procedures. Another idea? When at all possible, choose an urgent care center over an emergency room. They're a fraction of the cost. You can find the nearest one at urgentcarecenter.org. Do you check your grocery receipts? You should check your medical bills too. According to the Medical Billing Advocates of America, up to 80% of medical bills do contain errors. If your bill's big enough, it might be worth it to hire an advocate that can help you find those errors and understand your bill. When it comes to services like dental, finding a school can take a 50% bite out of bills. Best way to save on drugs? What's the same way to save on groceries? Using generics. You can also compare prices online and talk to your pharmacist about ways to save. Bottom line, saving on medical costs is certainly not as easy as saving on food, but it can be done. And I've got more ideas that will help you. Go to MoneyTalksNews.com and just do a search for saving on medical costs. For Money Talks News, I'm Stacy Johnson. Want to save more and spend less? Get the free Money Talks newsletter. It only takes 7 seconds to sign up, and it's full of deals and news you'll really use. Do it now at MoneyTalksNews.com.